Local anesthetics. Local anesthetic is a way for us to interfere with the conduction of nerve impulses and produce a loss of sensation in an given area. So really what we're trying to do is prevent pain in that area so that we can do a procedure. We are trying to also give multimodal anesthesia, so we're trying to prevent wind-up, we're trying to prevent the pain from becoming difficult to manage, and we're also trying to decrease the response to the pain in that area as well as a centralized feeling of pain. We also use local anesthetics to help reduce the amount of other types of anesthetic like inhalants or injectable general anesthetics that we use. So how local anesthetics work is they work at the site of administration as well as in the peripheral nervous system and the spinal cord, and it depends on where we're giving it and how we're giving it. Local anesthetics usually have the cane ending, C-A-I-N-E, and you can use other drugs with local anesthetics. You can use epinephrine, and that will increase the length of the anesthetic time. You would want to use this in caution, though. You wouldn't want to use it in like an ear or somewhere that doesn't have a lot of peripheral blood supply flow because this constricts down the blood vessels in that area. So how we use local anesthetics? Well, we can use infiltration, so we can inject it into the site, the tissue around the site that we're trying to provide anesthetic to. So if we were doing sutures, we could inject it around that area. We could do a nerve block, and basically this gives us localized pain relief. You can do this with a dental, okay? But when you're doing it with a dental, you want to make sure that you are cautious and that you are using care, because they can bite themselves. They can also paw at their mouth because they can't feel their mouth depending on where you give the anesthetic. A line block is where we give a continuous line of local anesthetic in the sub-Q, and it's proximal to the area. We use this for spays or for neuters. We do a line block in the area to help prevent some pain when they wake up from anesthetic. You could do regional, which is also called epidural, and basically you inject the local anesthetic either into the nerve plexus or into the spinal cord, and this gives them not only really good pain relief that lasts a long time, it also prevents movement. So you could use this for a C-section and not have to place them under complete anesthesia. So lidocaine is probably the most common type of anesthetic, local anesthetic that you'll hear about. It has a rapid onset. The duration of action is about 30 minutes to an hour. If you give it with epinephrine, it actually can last longer. It can last about 2 hours. You can use it topically as an infiltration, a nerve block, a line block, or regional block. You do need to use caution, especially in cats. It does have some toxic side effects. It has some issues to do with the heart, especially if you get it peritoneally. So bupivacaine is an intermediate acting local anesthetic. It takes a little longer to take effect. The duration of action is about 4 to 6 hours. You can use this with lidocaine, so you have that immediate onset of the lidocaine, and then you have the long-lasting effect of the bupivacaine. You can also use it with epinephrine, and that will give you probably about 12 hours of pain relief. You can use it as an infiltration, a nerve block, a line block, and a regional block. It doesn't have as many toxic side effects as lidocaine does, so that makes this a better choice. So topical anesthetics, proparacaine is a rapid-acting local anesthetic. It lasts about 5 to 10 minutes. It can be used for intraocular pressures as well as checking under the third eyelid. You don't want to use it more than 7 times, so a total of 70 minutes. Okay. Lidocaine, it's a more potent than proparacaine. It lasts about 10 to 20 minutes. It can be used for ophthalmologic as well as otic procedures. It also comes in something called neopre-def, and it can be used on skin.